As many of you recall, this project was announced in January 2000 of this year. The medical office building was promised in conjunction with the acquisition of this hospital. I'm pleased to say that we are delivering upon that promise. When construction is completed, the medical office building will be 15,000 square feet. And as you look around, you'll see balloons. Those balloons, I think we just heard that. Those balloons indicate the corners of our new medical office building. As you can see, 15,000 square feet is quite large, and we're very excited about it. On this corner here will be a canopy that will enable a drive-through area where patients can enter and leave our facility without being weather beaten. They'll be sheltered from the weather. That entrance will double as the main entrance to our hospital as well. The outside of the new medical office building will have brick colors that match the existing facility. And the reason for that is that we want to integrate the new medical office building with the existing hospital. I think it'll look fantastic. The new medical office building will have offices for 7 providers, 28 treatment rooms. It will have an imaging center. It will have a lab, 2 procedure rooms, and a conference room. The building is designed for the comfort of our patients and also our staff. The close proximity, as you can see, it joins right onto the existing hospital. It's designed so that those patients that require emergent services can be transferred directly into our hospital. Also, those patients that need direct admission into our hospital, it can enable a quick transfer. The laboratory and imaging services enables a smooth flow of patients and enables us to provide the delivery of service in a much more streamlined manner. We are excited about the new construction. We're excited about the impact it will have upon healthcare in this region. Also, the new construction is indicative of Southeast Health commitment to providing quality healthcare right here at home. I would like now to introduce our Chief of Staff, Dr. Jalal.
That's a tough lead to follow. Thank you, Adam. Good morning, respected dignitaries, honored guests, and fellow staff members. As the Chief of Staff, I speak on behalf of all the physicians and providers in saying that it is indeed an exciting day for the city of Dexter and for the medical community here at Southeast Health at Stoddard County, as we gather here for the groundbreaking of the much awaited and needed medical office building. As our administrator, Mr. Bracks, explained to all of us briefly some of its salient features, the benefits, the comforts that it brings to both our patients and our families and the providers. To me personally, the biggest thing it's going to bring to us is that it's going to take us in the right step to growing the medical community here, and furthermore, help us attract more physicians and providers to add to the small but dedicated group that we have here in Dexter. A wise man once said, there's a time for everything and everything in its time. That time for this medical office building has arrived. I want to use this opportunity also to thank the Southeast Hospital corporate officers and the Regional Healthcare Foundation members who've had the vision and have put energy into bringing this project to fruition. I vividly remember when Southeast took over the lease of this hospital, and we had a meeting as medical staff with some of the corporate officers. One of the promises that were made was that they would bring a high-tech medical office building to this area. This day is a testament to their commitment to this region and is a sign of many more great things to come from Southeast Regional Healthcare System. Let me applaud them for this effort. Thank you. As we break ground, I remind myself first and all the wonderful staff at this blessed hospital. Let us use this moment to renew our vows and re-energize ourselves to serve the sick and the frail at our hometown hospital. May God bless us all, and may He accept all our efforts. Thank you for your attention.
Thank you, Dr. Jalal. It's a pleasure working with you, sir. In planning for today's ceremony, we realized it was important to include the Regional Healthcare Foundation. The foundation has a passion for providing quality healthcare right here in this community, and our goals are aligned with you. Today we are honored to have Jack Norman say a few words. Jack and I are kindred spirits. Jack, too, has been an administrator of this facility, and he has left big boots to fill. Jack has continued to work and provide and nurture healthcare in this community through his work and service through the Regional Healthcare Foundation. Please welcome Jack Norman.
This is a very exciting day for all of Dexter. This medical office building represents the first of many good things to happen. This community is really fortunate to have a partner of the quality of Southeast Health. They bring to us an experience and expertise that we would never be able to accomplish on our own. Over this past 2 years, under the leadership of Darla Grossman, who is the chairman of the foundation board, we were able to forge a partnership with Southeast. It's been an exciting and rewarding past 2 years. I want to give a special thanks to Dr. Bill Kane. I don't know if Bill is here in the audience today, but he had a contact through Jim Limbaugh, who is the Senior Vice President of Business Development for Southeast. These two were classmates in college. And you know the old saying, it's not what you know, it's who you know? Well, Bill and Jim spearheaded that initial meeting, and we are thankful for that. I also want to thank John Ringer. John was our driving force in developing a lease agreement. He spent many hours on this. Also want to thank the entire board. Over the years, I have served on many boards, and I've never seen a board that was more unified, more excited, and more anxious to forge this partnership. As we looked at this whole partnership, we really came down to the fact that this is a family, and the family consists of Southeast Health, the Regional Healthcare Foundation, the Hospital Auxiliary, and the employees that serve this community. All of these together we have consolidated to extend to our community a high level of quality of health care. Now you're going to have to bear with me just 1 minute, since I am a quasi-hospital auxiliary. I'm one of the 2 or 3 males that work with this group, and let me say on their behalf, they are excited to continue to serve this new organization through their efforts of fundraising, and they do that by their outreach in this community through luncheons and through income through their gift shop. I also want to thank the employees. Oftentimes we go through these ceremonial events, and the backbone of what's going to transpire over the next few years is the delivery of health services, individual by individual, employee to the patient, and we certainly want to thank them. The regional healthcare system became an entity after the hospital years ago was leased, and from the very beginning this organization has focused on an outreach to serve this community in whatever way possible to bring healthcare services. In closing, I want to personally welcome Adam and his family on behalf of Dexter as a new couple coming into our community. Those of you who have had the opportunity to meet with Adam and to get to know him and to be around him know that he brings with him that Australian down under hospitality. Thank you, Adam.
Thank you, Jack, or should I say, thanks, mate. Now it's time to break ground on this exciting project. Breaking ground with us today, we have, first of all, John William Ringer. Please come forward, sir. John is a member of our Regional Healthcare Foundation, a former board member of our hospital, and a gentleman that has been instrumental in the formation of the original hospital. We owe him a great service. Thanks for coming. Darla Grossman, President of the Regional Healthcare Foundation. Thank you, ma'am. Dr. Jalal, Chief of Staff. Joe Weber, Mayor of Dexter. Thank you, sir. Scott Nelson, President of the Dexter Chamber of Commerce. Ruby Jones, Auxiliary Member. Thank you for all your service and all your team for our hospital. Joe Gilmore with Boulder Construction. He is the general contractor for our project. Paula Harris, South Health Vice President and my boss. Let's have a large clap. Okay. Dennis Fowler, State Representative. Thank you, sir. It's official. Construction is now underway. Thank you for joining us. We hope to see you in 2014 when we celebrate the completion of this project. Again, thank you for coming.